Thanks for joining us for the Perry Health Pulse podcast. We're always looking for new topic ideas, things that you as an audience want to hear about. Given a little notice, we can try and get speakers together from the healthcare field, whether it's from our hospital or if we have to look elsewhere to try and get someone to be able to sit down for 15 minutes and have that conversation that can benefit you. If you've got any topic suggestions, please make your way to www.perrymemorial.org/pulse, and there's a feedback form right there on that page where you can put in suggestions, put in as many as you'd like, and we can try and make sure that those get an episode. Because we really do want to tackle those things that you don't know about but want to know about. And with so much stuff on the internet, it's hard to tell what the correct information is. So we want to be able to provide that to you. For today's episode, we're going to be talking to two guests about home care services. In part, we're having this conversation because Perry is beginning a home care service. We've assumed ownership of a local home care service, and so we want to make people more aware about what they actually do. I think a lot of people don't know what's covered on it, who actually qualifies, and how it's different from certain other services. So we have two guests who are going to be speaking about home care. And with healthcare nationally moving towards a more outpatient basis, it just kind of makes sense that home care is a service that's going to be growing and becoming more common. And we're going to hear about why that is. Our guests today are Colleen Saylor and Eileen Hecht. Colleen was the CEO of In-Home Care VNA in Princeton for 12 years. Before that, she was working in public health, and now she's going to be working as the director of Perry Home Care. Eileen was the clinical director of In-Home Care. She'll now be working as the supervisor for Perry Home Care. And they're going to be here to talk about what home care means, what's available through it, and who can get access to it. So welcome, Colleen and Eileen.
Thank you. It's glad to be here.
So starting off, what types of services are offered through home care?
We have registered nurses, physical therapists, occupational therapy, speech therapy. We offer home health aid services. These are all considered skilled services through Medicare.
And are these the typical services that any home care would most likely offer?
Yes, they are.
So what's not covered under home care?
We are a Medicare certified agency, so we have to follow all the rules of Medicare, and they have books of rules. And so what's not covered, it's easier to tell you what is covered because they have a rule that says you must be homebound, and then they define that homebound rule, which means it's a taxing effort for you to get out of your home and get services at outpatient services. You have to have a skilled reason. So skilled being there requires a nurse or a therapist to come in and perform that service. And so what we don't do is we don't do homemaking services. We don't provide cooking, cleaning, laundry, errands.
It's more for the people that need to go to outpatient therapy but aren't quite ready there yet to get to outpatient therapy. They're the ones that need that extra help at home for, 3-4 weeks to get built up so that they can get out of the house and go to outpatient therapy.
And no driving. Our patients are not allowed to drive. They may leave the home to get their hair done. Somebody can take them to get their hair done, maybe go to church, infrequent visits somewhere, but they can't drive. We are not allowed to transport any patients, but we hook them up with whoever, is in their community that provides those services, because we cover LaSalle County, Bureau, Marshall, Putnam, Stark counties. So
it's a wide area.
It's a wide area, and so we work with whoever provides transportation in those areas if they need it.
We also hook them up with services that are needed, like alternatives and
homemaker services.
If they need them.
Yeah.
How is home care different from hospice?
Well, home care, we set goals for improving patients' outcomes, and we work towards meeting those goals and outcomes. Sometimes we can be a bridge to hospice where maybe they have a decline in their health and they're not going to be able to meet those goals or outcomes, so then we could bridge them to hospice. But that's about, yeah, we're totally separate from the hospice industry.
So that's more of an end-of-life care, and
Yeah.
yours is more so.
Ours is set up to improve people's health and get them better and back on their feet.
Okay.
Yeah.
Now, in terms of maybe both practice and regulations, how has home care changed over the years?
It changes constantly. And Medicare constantly changes rules. In 2018, we had to come together with an emergency preparedness plan. Each agency was required to, mandatory, so we had to do that. And then also they changed what they call the conditions of participation, which are basically the rules that allow you to continue in the Medicare program. So you have to update all your policies and procedures and educate your staff on all these changes. So it's constant. It's a constant evolving with Medicare.
Now, when I'm thinking about home care, I know I'm very unaware of what's available coverage-wise. It makes a little bit of sense that Medicare would cover it, but that other insurances might cover it is surprising to me. Can you go a little bit into both Medicare and for private insurances how home care is covered?
Private insurance will cover home care, but you need to call we have to call to get authorization first. And for instance would be somebody having knee or hip surgery and going home and need to recover. So it would require a nurse for a pain assessment, and it would also require physical therapy to get them back on their feet and move them towards outpatient services. So you call the insurance company, you get authorization, and you work with the insurance company on your visit, how many times you'll be going, and how long you'll be going. So yes, they do, yeah. But again, most insurance companies require that they do have a homebound clause, that it's a very taxing effort for them to leave the home.
It does seem like overall that insurance and Medicare are all moving away from, just like our hospital is moving away from inpatient care towards that outpatient, even to the point of being in the home. Why is there that transition?
Home care doesn't cost as much as inpatient services. Home care is really very cost effective for Medicare, for private insurance. I don't know what it costs a day for the hospital stay, but it's nowhere near what it costs to provide those services in the home. And studies show they do better. They heal faster in the home. They just do better overall when they're able to stay home and recover.
All right, so let's get a little bit specific about Perry Home Care, which starts June 14th. If somebody wants to get started with it, what's the process? What should they do beforehand, and then what can they do to get started with it?
Well, they can always call us and ask us any questions that they may have, but the best place to start is with their physician. They would need to see their physician for whatever the problem is that they're having and would like home care for, so that he can document that he saw them, and if it's a Medicare patient, and even if it's an insurance patient too. And then we have that documentation and an order from the physician to get started.
The nurse goes out and does the admission and then works with the patient and then gets physical therapy or occupational therapy or speech therapy involved, and then they make their schedule with the patient so that it all works out.
So very convenient on the patient's schedule then.
It is, yes.
Sometimes we find when we go out on these visits, as the nurse does her assessment, that maybe they don't meet the qualifications for Medicare. We're not a chronic illness type program, and we are limited on our visit schedules. Like, we can go daily for a short period of time, but Medicare does not allow us to go daily for a long period of time. So the nurse assesses whether this patient will meet the criteria for Medicare.
Okay, so you're saying that if they go see their physician, now what about patients who normally just see a nurse practitioner? Is it okay to just see them to get it signed off, or does it have to be through a doctor?
Yes, they can go to their nurse practitioner. Then we will work with that office to get the physician who covers the nurse practitioner to co-sign on the nurse practitioner's orders. I tend to get stuck on the physician because Medicare is focused on the physician, but in just the recent couple of years, they've been allowing nurse practitioners to do more, and then with the physician co-signing.
Typically, how long would home care services last, or what time of day? Can you describe a little bit about how that process actually happens?
For each admission, Medicare allows us a 60-day window. They don't often need that 60 days, but we have it if we need it. So the nurse will go in and do an assessment and determine how long the nurse feels they need to be in that home to get done with, to meet the goals that they establish with the patient. It's a patient-involved plan. So we may be there 4 weeks, we may be there 6 weeks, we may be there the whole 60 days. And if at the end of the 60 days they have not met their goals, but they are progressing, then we can recertify them for another 60 days. But it's a 60-day window with Medicare.
Let's say a patient is too severe to really qualify for home care. They need something else. What are the alternatives?
Well, we first let the physician know, and we also let the family know. They probably need something more intense than what we can provide. And so it is up to the physician then and the family to make that decision. Yeah, we just provide the assessment and try to educate the family on what's going on with the patient.
On that note, a lot of what you do is not just care, but is providing that education. Can you speak to that a little bit?
We we talk to the patients about wound care. We do physical therapy. We will educate them on a big one, CHF and COPD, just to try and keep them out of the hospital.
And another goal of ours is to educate the family or a neighbor, whoever's involved in the care of this patient. Our goal is to educate them so that when we leave, they have somebody else to fall, when we're done, they have somebody else to fall back on. The nurses will go through all their meds and educate them on the care, taking their meds and when to take them and adverse side effects of their medications. Mm-hmm. We also do lab draws while we're in the home taking care of this patient. But Medicare does not allow us to just go out and do lab draws and nothing else. So if that patient is on service and receiving other care and needs a blood draw, we are able to do that.
All right, so very good. So Perry Home Care starting June 14th. If that's something that you're interested in or you know someone who might qualify for that, be speaking with your provider to find out and get that referral. And Colleen and Eileen, thank you very much for joining us and giving great information.
Thank you.
You're welcome. Thank you.
All right, that just about wraps up the episode. Thanks for joining us to hear about home care. If you'd like to learn more, obviously you can go to the page for this. If you go to perrymemorial.org/pulse, it's got this episode, it's got the details about it, all those resources about the information about the speakers, all of that's hosted there. If you want to learn more about Perry Home Care, you can go to www.perrymemorial.org/homecare. You can find out all about it and read some of the frequently asked questions. Once again, thanks for joining us for this episode. We're always glad to have people taking an active interest in their health and wellness and learning more about what small communities can offer with healthcare and things that you can do for yourself to be proactive in living a long and healthy life. Thanks for joining us.